So I have headaches, brain fog, pain in the shoulders, needles right in between the shoulders, stabbing pain because there's scoliosis right there. Yeah.
Okay. So we went over the consultation, and you were describing something like brain fog, you some difficulty sleeping.
Right.
Okay. How's your memory?
Getting worse and worse.
Short-term memory is getting worse and worse, right?
Yes.
How about focusing?
A lot worse.
Okay.
Getting worse.
So when I hear a case where there's brain fog, short-term memory, focusing, difficulty sleeping, so on and so forth, all this long laundry list of problems, I want to focus on what's going on with the upper cervical region. Because clearly, just like the GW bridge, if the whole entire GW bridge is blocked off, what's going to happen? The whole entire BQE, Cross Bronx is digging because of a nice parking lot.
Right.
Nothing's moving anywhere, right? So clearly, something's blocking the nerve function from your brain to the entire body.
Oh my God.
Okay, so there's that. We have a severe interference over here. Okay, what we call subluxation. All right. Now, taking a look at the biomechanics. All right. Okay, so I concur and agree with you. Your neck is reverse curvature. Right. It's supposed to be the opposite direction.
Right.
You would do this biomechanically only if the brain recognizes there's so much rotation and twist like this. What the heck is going on over here? We have to save the spinal cord, otherwise it keep on twisting. Eventually it's going to rip, okay, and get damaged. So that's why the brain has no choice, but it says, I need to try to untwist it, try to go this way. So hence, therefore, the neck goes opposite direction. Okay, this is like the final safety mechanism. All right, but unfortunately, the twist is still happening. Therefore, it's going all straight up into your brain. Therefore, all those symptoms you're experiencing right now. So therefore, right into the brain itself is the thalamus and everything else like that. It's
hard time concentrating,
right.
Brain fog.
Right. It's like the Grand Central. Okay.
Yeah.
Or like a route, or like an internet router. It needs to direct information where it's going into the cerebellum itself. It's having trouble doing so. Okay, because there's that massive miscommunication going on over here. So what's causing this curvature? Then we're going to take a look what's going on below it. So we also have this one. So if I'm seeing this, okay, then we're going to keep on looking way below. What's going on? So everything's still rotated like this. Straight down to here. Okay, then we see you have an old spinal fracture over here, what we call a spondy. Okay, right, spondylolisthesis. In addition to, the surgeons also put an artificial fake disc in there. Okay, and when they bolted it on, this bone over here, normal alignment should be here. But because, again, to the viewers to explain, you had a fracture here and a fracture here, both of these spots. Now, if it wasn't fractured, no matter how much you push forward, it doesn't go forward. Just like elbows. Elbows don't go past 180 unless you break it. Right? So you broke both of these, that's why it went forward.
Broke it like naturally or?
No, you fractured it. So these two got fractured off, that's why the bone went forward. Okay. Now, these two right now, they're not lined up. It's like this. So the surgeons, they bolted in that permanent position.
Got it.
So because, in addition to, I'm seeing here the fifth lumbar vertebrae over here, it's rotated that direction. So now your whole entire spine is now bolted in this position. Okay? Yeah, that's going to present some biomechanical challenges because how the heck are we supposed to untwist tire over here when it's surgically fusion and they bolted in that position?
Right.
Okay? So there's going to be some limitations. I'm going to do what I can to unravel this, untwist this, okay? But can we permanently correct it? No, because again, they bolted it there.
Right.
All right. So now let's take a look what's going on way below over here. Okay. What's going on with this fellow over here? Is this biomechanically stable in terms of the foundation itself? Well, it's a little bit backwards. All right. Things that make it go backwards is going to be either a posterior sacrum, a sacral segment, ASIN or ASIN ilium. So when I take a look over here on this side, that's what I'm expecting. It's no different like driving a car. When we make a left turn, the car should turn to the left. It shouldn't go to the right.
Right.
So over here, I'm looking for, is there any rotated sacrum or is it ASIN or ASIN? Well, let's look over here. Okay. Now, the gluteal full shadow, that's smack in the middle. Normal alignment, that's what we want. That's good. Okay. How's the pelvis tilting forward and backwards, okay? We do have some kind of issue going on over here because the vertical heights are different, okay? Now, what I'm seeing over here, okay, this is a little more peaked, this is more shallow over here. So now, correct, so now we got a little tilting going on over here, and this is what's interesting. So we have a slight little AS ilium going on over here, and slight PI over here. But even though this is smack in the middle, your body is still rotating a little bit towards this direction, EX direction, towards this way. Because that's what I'm seeing over here, okay, the ischium over here.
Right.
So now another component is the fact that your haunted hip is sinking down this way.
Yes.
So in order to level this, there's got to be a PI-EX or PI-EX to re-level over here, and that's what we have over here so far, misalignment-wise. That's good. Now let's take a look at the sacrum itself. Is everything in proper alignment? It should be here, but no, it's slightly tilted this way.
Right.
And everything is so far level until we get right there, second sacral segment, it's a little tilted this way. And that's what we see here. You have one huge gap right over here.
Right, I can see that. Yeah.
Yeah, there's that gap over here. So that helps explain that. So now we're going to confirm on you, all right, that in terms of here, now bear in mind to the viewers itself, we don't find the subluxations on the film, we confirm it on you. It's just one data set, all right? So this one over here, I want to verify, confirm on you, is this the actual problem itself, or are we dealing with this problem over here, all right? In addition to, because your spine is twisted like this, addressing that second sacral segment, it may help take quite a bit of this twist out like this. I may need to address this one over here because it's badly twisted over here. We're not going to touch here. Even though you may be very symptomatic right there, this may not be a good idea to address. Why? Because in that huge kink and the way it recompensated here, if we try to address here, what's going to happen? They're going to swing right back into it. Right. We have to work on the tail ends of it. So over here is a possibility, but also what I'm seeing here, you have a severe occiput misalignment. So, right, just skull itself. Okay. Here, and your atlas, it should be leveled, almost parallel lines. Okay. It's way up here. So right now, your skull itself is like that. Right. You got it. So when we fold it this way, the back skull part of it, okay.
Pressure on it.
You got it. Your spinal cord, in addition to, not just spinal cord, your brainstem, it extends this far down. So when your skull went into this direction over here, the occiput itself, it's putting physical pressure onto your brainstem. So yeah, that help explain a lot of things. Why you feel all that brain fog, you know, what you call, you know, difficulty concentrating, focusing, memory shortness, yada yada yada. You got drowsiness the whole time, 9 yards. Why? Because now you got one heck of an obstruction right at the brainstem itself. Okay, yeah, it's one thing to have a spinal cord pressure, but a brainstem, you know, the actual brain itself, yeah, no wonder it's not a happy camper. All right, so yeah, we got that fellow right there.
All right.
Now, so what's the cool thing about it to the viewers, I want to show you here. Okay, this patient actually did the EOS system. So there are a few of those hospitals here in New York City. They do a whole full body scan of it. And I did this, I realigned it to the Gonstead specification so I could do a proper biomechanical analysis. And this is only 2 months old over here, and I wanted to confirm any changes. So far, biomechanically speaking, no, we're talking about the exact same biomechanical issues I'm seeing from this EOS system all the way straight to my film, my full spine film here as well. And I'm also tracking in terms of what's going on in terms of, you know, your knee biomechanical misalignments and also your ankles and the feet over here. No, we're all seeing leading to, yeah, we have to address, see what's going on in this pelvis over here. And again, we need to address here. And most likely, you know, may not need to do that, but the occiput, yeah. So now here's another component as well, right? This is important to the viewers, right? There is actually 2 predominant nerve systems. It's what we call sympathetics and parasympathetics. Simple way to put it, one acting like a gas pedal is sympathetics, and the other one is a brake pedal. We don't want to drive with the brake pedal and the gas pedal at the same time.
Right.
Okay, that would be a bad thing. So we're gonna In your case, most likely, we're only going to state just the parasympathetics today. As in other words, that's your main chief complaint, okay? And we're going to triage this, guys, okay? We're talking about the brain fog and all the other neurological problems. Okay, let's do what we can to take some pressure off of that brainstem over here. And also, let's work on the parasympathetics over here as well. Now, visualization and inspection, you're going to come a little closer, guys. Look at that huge muscle knot over there and all the swelling over here. So, let's take a look, see what else is going on. We're going to scan your spine. And we do see core pressure. It's going straight all the way down. Holy Toledo. Okay, you do have a slight reading down here. Right at that second sacral segment level. Yep. Ooh, Nelly. Way over to the right. We got 20 points to the right on that fella. How's this fella right here?
Yeah, a little pain right there.
Yeah, right there. Yeah. Also right there too. I got it. I just confirmed it on you, this second sacral segment, that's in trouble. And that's just right below the fusion. Yeah, your cervical is very, very spastic. Everything's just protecting this upper cervical right here. Tender right there?
Right here?
No, where I'm touching. Right there? Not too bad. But what over here?
Yeah.
Yeah, right there, huh?
Yeah?
Yep. So right hand side.
Yeah.
Yeah.
On the right. Yes.
Feel that right there? You can't move right there. So
No.
there's that AS occiput right there.
Mm-hmm.
Just relax. Oh, come on up.
All right.
Okay. Why don't you walk around a little bit?
A lot better.
Tell me what's better.
I feel more stable and steady in walking. More steady and stable in walking.
Okay. How's your up here?
Up here a little.
What do you notice that's different in there?
I feel dizzy a little bit now.
Okay, that's to be expected.
Mhm.
Any other changes?
And I feel a rush. I feel like a more there's like a more awareness.
More awareness.
Like I had 2 cups of coffee now. Yeah, absolutely, yeah. I believe I got a caffeine, a lot of caffeine.
Nice. How's the focus?
Yeah. I think a little clear, not a little, like more clear.
How much clearer would you say?
I would say, God, man, like 35, 40%.
35-40%. How's
Yes.
the brain fog?
Brain fog, better, like concentration and brain fog, like 40% better.
Excellent.
Yeah. So from the base, you can actually.
Well, remember what we just did for you. As I explained before, your whole spine was twisted up like this.
Right.
I had to just stabilize. Now, I'm not saying I went all the way over here. Can't do that because they bolted on here.
Mm-hmm.
We had to just unravel a little more, take some pressure off of this twist. Now let's start working on the other end. Try to get you a little more this way.
Wow.
All right.
So now the signals will go up and down smoother.
You got it. That's what it is. No, just relax. Let it go. There it is. Let's check it. See, that's a multi-band right there. All right. All right, come on up.
All right.
All right. Go ahead, walk a little bit.
More focus.
More focus.
Yeah.
How much compared to before to now?
Like since after we did the bottom, I would say 20% more.
20% more. So how overall right now compared to before today's visit to right now?
60%.
Nice.
Drowsiness way less. I would say I don't feel sleepy as much as all day long as I feel. 50% less sleepy. I told you like I took 2 cups of coffee right now. Better overall, better like 60%.
Nice.
60%. Thank you so much.
Oh, you're welcome, brother. You're welcome.
Fantastic job, doctor.
Oh, you're very welcome. So that's what the program is going to be, all right? Now, you're still not out of the woods.
All right.
Like I said before, I cannot permanently fix that because the surgeons, they built it in place. Okay? But what we're going to do is we're going to try to stabilize this as much as possible, all right? Keep up with the homework, what I'm about to tell you in a bit, okay?
All right.
And just with the neck and the low back and the following visit, let's see how you respond to that.
All right.
All right?
Thank you so much, doctor.
Oh, you're welcome.
Pleasure. Nice meeting you.
You're welcome. Take it easy.
Thank you.